So Alberta Premier Jason Kenney announced today his province will take the lead on a new pilot program that would use enhanced testing to replace that mandatory 14-day quarantine for international travelers. The program is being launched at the Calgary International Airport next month. Results will give travelers their results within 24 to 48 hours. And if negative, travelers will be able to leave isolation, but they still have to avoid crowded environments and check in daily for a week. They're set free, I guess, when they receive their final negative day on day 6 or day 7. Essentially, it cuts quarantine in half. Are the risks worth the rewards? And will other cities and the whole country follow suit? MPs are here to discuss that. The Parliamentary Secretary to the Minister of Justice and the Attorney General, Arif Virani, is here. Conservative health critic Michelle Rempel-Garner is here, and we'll talk about her motion in a minute. And Don Davies, the NDP health critic, joins us. Great to have all of you here. Mr. Virani, I'll start with you. This is a joint project with the Government of Canada and Alberta. Why launch it just in Calgary? Will this be rolled out in the 4 other cities where flights can land, Montreal, Vancouver, and Toronto?
Well, thank you, Evan. I think the reason why it was launched in Alberta and specifically in Calgary is because that's exactly what the Premier Kenney asked of the federal officials. So we were happy to cooperate with that request. I understand there's already some discussions that if it goes well, it could move to other cities in Alberta. And you should know, and your viewers should know, that there's already discussions between McMaster University and Pearson for engaging in a similar study. We're keen to see the results of this study. It's an encouraging sign. Obviously, rapid tests are becoming now available, and the usage of them and their accuracy is something that we need to evaluate. So we're looking forward to seeing the results of this study as it goes forward.
Right. I mean, again, we're saying rapid tests. The results still are 24 or 48 hours. So it's not this 15-minute rapid test that a lot of folks are talking about. Michelle Rempel, what do you make of this?
This is something that the Conservative Party has been raising for a long period of time now. I'm glad to see the government listening to the Conservatives in terms of looking at technologies and pilot programs that other countries around the world have been looking at for months now. It's too bad that we're behind the 8 ball, but this is something that I'm actually looking forward to studying at the Health Committee should the Liberal government support our motion that's in front of the House today with regard to studying this type of data. Again, we want to keep Canadians healthy and safe, but we also need to understand that a 14-day quarantine is something that a lot of Canadians can't afford. I'm worried about compliance. And certainly I think that that quarantine is something that we could be looking at augmenting with things like rapid testing.
All right, let me go over to Don Davies for a second there, and Michelle will put her earpiece back in. Don Davies, look, the 14-day quarantine, we all know, has had massive impact on travel. There's a knock-on consequence economically. Anything that can shorten that would be good. Do you have concerns about the use of these tests?
Well, I do. I mean, I'm cautiously optimistic, and with great respect to my colleague, Michelle, I don't think we should be listening to the Conservatives. We have to be listening to the science and the evidence. Now, it's very promising. I mean, any kind of technology that might allow us to have a quicker return to some sort of normalcy, I think we have an obligation to pursue. But I want to make sure that there's really, really tight checks and balances on this, because, as you pointed out, Evan, if someone gets a negative test after 48 hours, they are then released into the community coming from abroad for 3, 4, 5 days after that. And that does present an opportunity for them to potentially transmit the virus. So these checks and balances of having them check in, wear masks, avoid certain high traffic areas are very important, but we have to take a really, really careful look at this, because we want this to work, but we also don't want to unwittingly introduce the transmission from out of the country into Canada. We saw that, what happened when we did that with the States early on in this pandemic.
Okay, guys, I want to appreciate some of our viewers may have heard a phone and a couple technical issues. Welcome to live television during the pandemic. It's not just airports. All of us are dealing with it. I think we all completely understand that. Welcome to the new normal. Arif Virani, let me just bring you back in. How long will the study be? What kind of data is the government going to collect about this so we can know how fast this can, A, if it's effective, and B, when it can be rolled out, if it is indeed effective, to other places?
So my understanding is that the study is 26 weeks long, or until they aggregate as many as 52,000 tests. So further to Dawn's point, we are very scrupulously following the science and taking our cues from public health officials. And it's been in close collaboration with Alberta Health Services that we've launched this study, and we're cooperating with it. And we'll be looking forward to similar studies that are taking place when they eventually roll out, as I mentioned, between McMaster and Pearson, for example. But following the science is critical. We don't want and have never wanted politicians to insert themselves into making decisions that are better made by the scientists. And we've always tried to empower the scientists to make those decisions in also what is in the context of a very evolving and dynamic pandemic and dynamic virus. Obviously, our knowledge of how it's spread now is very different from our original knowledge back in January and February. We're responding to that in a flexible way. We're trying to keep the economic livelihoods of Canadians also top of mind.
I guess my question would be, why are...
Go ahead.
I guess my question, Evan, would just simply be, why are we so behind other countries? Of course, we want to listen to science. We want to review that data within Parliament. But this is something that many other countries have been doing for a long period of time, especially in terms of pilots. I think it's sad that Canadians are always at the back of the line for this. This isn't about politicians inserting themselves. It's about politicians making sure that the scientists are getting that data out, that we are piloting these things. So we're slow, we're behind, but at least there's some progress here, and it's exciting.
Okay, but Michelle Rempel, just quickly dovetail into that, because these are some of the things that the motion that you as the health critic have put forward, and it looks, by the way, like the NDP is going to support this. What exactly do you want from the government? Because the government's saying it's so expansive in the middle of the pandemic that it's actually going to distract some of the key workers from the work that they want to do. So just explain what's in this motion and why you want it.
Well, first of all, when we talk, the government this morning started off by saying that this would paralyze the government, but it's really been the Liberal Party that's done that. They prorogued Parliament, they shuttered Parliament. Dawn and I experienced the Liberals blocking our committee for the last 2 weeks on this very motion that was in front of Health Committee. This motion allows the Health Committee to study things like the very big question of, we've spent a lot of money. Where are we at? Are we on the right path with regard to COVID-19 responses, especially when it comes to rapid testing, vaccine production, our warning systems, et cetera? If we're on the right path, great. If we're not, what can we do to course correct? There's nothing hyperbolic in this motion. It just moves forward. Now, with regard to the information that's being requested, this motion has been on the books now for over 2 weeks. It shouldn't come as a surprise to the government. And I found out today through some reporting that was done that over half of the government's freedom of information request staff have actually been kind of put on the back burner. The Minister of Health actually in question period today that's actually insinuated that she didn't think that freedom to access to information was important. No one had asked her about it. There are staff that can do this. We're not asking doctors or nurses to do this. This is all about getting information for parliamentarians to be able to say, government spent a lot of money. Are we doing the right things? Where do we go from here? And now is the time to do it, especially with record number of COVID cases being reported in provinces across the country today.
Don Davies, your party, this is not a confidence motion, by the way. The Liberals are not going to make this a confidence motion, as I reported earlier in the day, but your party is going to support this. What do you want to see, and why do you support this motion?
Well, we want to get to work as soon as possible and get the Health Committee focusing on what it should be and what Canadians expect us to be working on, which is on the #1 public health crisis facing our country. And all this motion does is it says we're going to study COVID-19, and it allows the committee to delve into any area that we want to delve into. It's got a fair allocation of witnesses, and the list of subjects, Evan, are not required to be going into. They are a list of items that are indicated as things we could go into. The Liberals, they prorogued Parliament and wasted time. Now they're filibustering at the Health Committee to waste time. Canadians want answers. They want us to work together to get to the bottom of this. And as Michelle said, for the purposes of holding the government accountable, which is our duty, but second of all, so that we can actually make positive suggestions to the government moving forward. So if you look at some of these things, where are we at with vaccine development? where are we at in terms of a vaccine protocol for distribution? Where are we at in terms of our early emergency planning system, which the Liberals dismantled? Is it there now? Are we prepared for the next pandemic? These are questions that will prepare us on a forward-looking basis.
Okay.
And frankly, on documents, the Liberals don't want us to get any documents. This is a targeted, focused production that'll help the committee get answers for Canadians.
So Mr. Virani, this is 8 months into this thing. We're spending unprecedented amounts of money. These seem like reasonable requests. I grant you, it's expansive, but so what? It's democracy. Will your government not filibuster and cooperate and support this motion?
So I have about 6 things to say in response. So the notion that Canada is at the back of the line in terms of the global response to the pandemic is categorically false. Your viewers need only look to our southern neighbor who are having a debate tonight at the presidential level to look at a nation that's failing. In terms of what the staff are doing, I think Ms. Rempel-Garner completely mischaracterizes. The staff have been redeployed across government to assist the pandemic, and it has been all hands on deck since February. That is what the staff are doing, and I say that with some veracity as a spouse of somebody who is a quarantine manager. Third is that the Health Committee has had about 34 meetings thus far, probably the most out of any parliamentary committee. So the notion that is not doing its work is also false. The fourth, fifth, and sixth points are that the disclosure that they're requesting would also jeopardize the very things that Mr. Davies and Ms. Rempel-Garner want, which was an adequate response in terms of PPE vaccine development.
Why?
Why?
Can you just explain that? Can you just explain that to our viewers? Why would disclosure jeopardize that?
Because what they are asking for is proactive disclosure of our procurement negotiations with third parties that relate to vaccines and public and personal protective equipment. If we were engaged with a discussion with Novartis about a vaccine, for example, Novartis is not likely going to be willing to disclose that private, confidential commercial information, and that will jeopardize our ability to procure the vaccines. And the fifth and sixth points, Evan, are that this motion, despite its length,
let me hear
doesn't
this, and
address.
I'll give the opposition a chance. Go ahead, Mr. Virani.
Is that the fifth and sixth points are that notwithstanding the 2 pages in length of this motion, it doesn't actually cover 2 things that Canadians are very concerned about, which is the conditions of long-term care, which is a health matter for the Health Committee, and secondly, the conditions of Canadians' mental health, as Canadians are experiencing this pandemic. Mental health is clearly being affected, and that is not the subject matter of that.
That's just factually incorrect. I mean, the motion, I'll quote from it. It can the committee can evaluate, review, and examine any issues relevant to the situation, such as, but not limited to, and then list them. So what Arif is saying is that's just factually incorrect. Okay, we can study mental health, we can study long-term care, and actually it's also absolutely misleading your viewers when it comes to sense of commercial transaction. In this motion is a specific redaction criterion right from the ATIP legislation that says that they can redact for anything that might interfere with contractual negotiation and national security. So
it's unfortunate
that's just simply
he was misleading your viewers.
I would encourage all of your viewers, Evan, to actually take a hard look at the actual text of the motion. It's available on
We did. We wrote it.
You should start by reading it.
I've read it. Thank you, Mr. Davies.
Okay, guys. Arif Virani and Michelle Rempel-Garner and Don Davies. There's going to be a vote on this, and believe me, we read the motions as well. Okay, thanks for being here. We'll be picking this up again later in our program in the press gallery as well. But thanks to those 3